In this video, we are going to see about bladder training. So as we have already talked about level 1 to 3, we are now going to talk about how a child can be trained in level 1. So this is the first level, and once the child clears this level 1, he can be trained to clear level 2 and so on. So now let us look at some preparation that is needed before we start bladder training. So what are those preparations? So availability of a caregiver. One particular person is needed to take care of the child or to train the child. We need to set apart a specific time period. So most of the parents and the caregivers are busy in their work, so they may not be able to spend time to do this particular training. So if anybody wants to do, they can set apart a specific time period. They can do it during their holiday time, or they can take a week or two off and then they can start training, because child training needs consistency and also patience from the side of the person who's training the child. So that is very important to achieve success. So as we've already seen, the age to start is around 18 months. So these are the preparations that we need to keep in mind. The first step in this level is to prepare toilet schedule. So how do we do this? We need to observe the child throughout the day and need to note the time whenever the child voids. So we have to note the time gap between each voiding. So we need to see how frequently the child voids, maybe every 1 hour or every 2 hours. So we need to note that and then record it. So we have to do this for at least 2 to 3 days to get an idea of how frequently the child is voiding. So there are certain steps involved to train bladder control. So let us look at those steps. So we need to start training during the day and let the child stay without pampers during the day. So we have to allow the child to feel wet. So when the child is wearing the pampers, the child may not feel the wetness. So it is always advisable to remove the pampers so that the child is able to feel the wetness. So what is the procedure? So we have to decide on a place where the child needs to void. This place need not be always a restroom or a washroom, because some children may find difficult using the restroom. Some children may feel scared or frightened to use the regular washroom or the toilet. So to start training the child at the initial stage, we can always decide on a place that is outside the house or any other place which the child is comfortable with. After you decide on the place, what we need to do is we have to take the child to that particular place when the child gets up from sleep. This can be early in the morning or can be after a nap in the afternoon also. So now what do we do? After that, we have to remove the pants. We have to use a word or a sound in a particular language that the child is familiar with, and then we have to encourage the child to void. We need to wait for some time, and we can pour some water over the feet of the child if needed. Wait at least for 2 to 3 minutes. If the child voids, then we have to applaud the child. We can clap for the child, or you can tap the child at the back, or you can give a hug or a kiss, just to make sure that you're happy and the child has achieved something. This is very important, because only when any act or a behavior is encouraged, the child will be motivated to do the next time. So it is always advisable that every time the child voids, we need to encourage the child. Then we need to take the child again after the observed time gap to the specified place. It may be 1 hour or 1.5 hours, and we have to follow the same procedure what we did. That is encouraging the child to void using a gesture, sound, or a word. Okay, so by doing this, we are helping the child to void. We can continue this routine for another 2 weeks. every day the child is taken to the toilet and encouraged to pass urine. And once the child passes urine, the child is given a great applaud. So, after following this routine for 2 weeks, we can see that the child is able to void whenever he or she is taken to the specified place. If the child is able to void for more than 70% of the time that the child is taken to the place, then the child successfully clears level 1 training. Here, we know the child has understood the concept of being taken to the toilet and voiding. The child has formed some kind of an association. This might take 3 to 4 weeks for some children, or sometimes it may even take longer. Sometimes some children will be able to learn this association faster. That is, within 3 to 5 days, the child may be able to understand the concept and will be able to follow the schedule. So, the time limit to achieve success varies from 3 to 5 days to 3 to 4 weeks. So, it is important for the caregiver or the trainer to be patient and consistent. Once the child learns to follow the schedule, that is, once the child learns to pass urine inside the restroom or in the specified place, we need to continue to practice what is learned in the daily routine. So, this has to become a routine in the child's life. If the child is trained for a week or two, and once the child learns, and if this routine is stopped, then the child may forget, or he may not be able to follow the schedule again when it is restarted. So, it is always advisable to follow the practice or the routine what is learnt in the daily activities. If the child does not void, what to do? We need to take the child back. You wait for 3 to 4 minutes, and if the child does not void, we can take the child back, and after 5 to 10 minutes, we can again repeat the same procedure that was explained already. And after 5 to 10 minutes, the child may be able to pass urine. And once the child is able to pass urine, again you have to applaud the child, encourage the child, and then follow the same routine. We need to be patient and wait for the child's response. Consistently doing this is very important. If we do for 2-3 days and we find that the child is not successful, is not able to understand, we tend to immediately give a break or stop it. And then again, after a month or after a couple of weeks, we will again try doing it. If we try doing like this may not help. So, we have to set apart a period of time that is at least 2 to 3 weeks for the child, and then continue this training consistently every day without giving any break. Whether the child is successful, is able to follow or not, we have to continue training the child. We have to get the child to follow the routine that has been scheduled. So, if the child is able to void in the specified place for more than 70% of the time that the child is taken to that place, then we can say the child has successfully cleared level 1 training. Once the child clears level 1 successfully, then the child can be taken to the next level and the child can be trained in the next level, that is level 2. How to train the child in level 2 we can see in the upcoming videos. But even after trying for 2 to 3 weeks consistently every day, and you find the child is not able to be successful in this particular act, then we need to get professional help. We can try for another week or two, and then it is advisable to get some professional help. Now, I would like to talk about some tips and tricks. These are things that are very important, and you need to keep it in mind when you are training a child. So, what are those? Consistent place and person. It's very important. If you want to make the child understand better, you need to use the same place again and again every time you take the child to void. And if possible, the person who's training the child remains the same, then again the child is able to understand better. So if the same person is taking the child or training the child to void, then the child understands, okay, every time I go with this person and this person wants me to do this. So it is easy for the child to understand. So make sure that you have a consistent place for voiding and also a consistent person for training. The next thing is consistent use of one specific word, sound, gesture, or picture. So, this I've already discussed. So, it is very important that you use a specific word and that word should be familiar to the child. So, some sounds or words can be used by the child, or the child already uses some of the words or some sounds in his natural language development. You can choose any one of those words or sounds. Even if it is a sound, it is okay, but you make sure that you pick up one particular sound or word that is there already in the child's vocabulary and use that to indicate this particular act. It can be pee pee, or it can be poo, it can be choo choo, or whatever it is. Or if you want to develop a new word or sound, you make sure whichever sound that you're using or whichever word that you're using is easy for the child to understand, also to repeat that particular sound or a word. So you would expect the child to indicate by himself or herself. That is, the child has to come to you and say pee pee or choo choo, something like that. So you make sure that you choose the right and the easy word or the sound for the child. So this is very important that you need to keep in mind. Next, consistent practice without gap. So we need to practice every day till the child learns. You cannot do it for 2 3 days and again you stop and then you restart again. This will create problem in the child's understanding and the child will take longer to time to get trained in this particular act. So you make sure that you consistently practice without any gap, and that's why I suggested that you select a period of time when you are free, either during holidays, or you can specifically take off from your work or from your regular duty and then focus on this particular act. Next, again, is perseverance. It's very important. Some children will learn the act within a few days, but some children will take a long time. So it can go up to 2 to 3 weeks also. So in that case, you need to continuously practice without giving a gap, and you have to practice and keep practicing, and only that will bring good result. And after the child learns the skill, it is also important for you to keep the practice in the daily routine. So sometimes when you know the child has already learned the skill, you will just leave the child thinking that the child will do by himself or herself. But after a couple of days, the child may forget daily routine. So after the child has learned, you have to keep insisting the child to go and void and encourage the child and remind the child. And another important trick that we need to keep in mind when you're starting the training is that you have to make use of the best time. Okay, so there are actually some best timings in the child's day. So one is after nap. Soon after they wake up from their nap time, if you take the child and encourage the child to void, you will get more result, meaning the child will definitely void during that point. Soon after the child wakes up from the sleep early in the morning, if you try this training again, this will work out very well, because the child's bladder will be full and then the child has more chances of urinating. So if you do it during these times, then the child is able to associate and understand better, and thereby will be able to retain those things that he has learned when you practice in between the day. There are certain things that we should not do when we are training the children. What are those? After taking the child to the restroom or the specified place, we should not scream, we should not shout at them, and we should not restrain them or physically force them or anything. And we should not threaten or beat the child. We should not get angry if the child wets the clothes. Sometimes the child, when you take the child inside the restroom, he or she may not pass, but as soon as you take the child outside, the child may wet the pant, wet the clothes. So at that point, you should not get angry with the child. Rather, you need to explain to the child whether the child understands or not, and then encourage the child again the next time to pass inside the restroom. any doubts and queries can be addressed to this particular mail ID.